Hello, everyone. My name is Dr. Sabina Ali. I'm a pediatric gastroenterologist and associate clinical professor at UCSF Banyoff Children's Hospital and the medical director for the IBD program at our Oakland campus. I welcome you today. We are going to talk about the pediatric IBD basic. The topic of today is diet and nutrition. I have no disclosures. The objectives of today's talk is we're going to talk about the importance of nutrition, specifically in IBD, and what is the impact of diet and nutrition for an inflammatory bowel disease patient. What are the healthy eating principles? Are there any specific diets that have been looked at in treatment for inflammatory bowel disease? What does the research say? And what are the resources available through Crohn's and colitis? So let's jump on into the topic of nutrition. What is the importance of nutrition? So first, I think it's important to understand the difference between diet and nutrition. So diet is the foods you eat on a daily basis. Nutrition is how your body uses all those nutrients you're eating to maintain a healthy lifestyle. The role of nutrition is very critical in maintaining treatments and care of IBD. It is very important for children with IBD to get proper nutrition. And why is that? Because it helps with making the medications work more effectively, improving healing, immunity, and of course, with our very active young kids, energy levels, and minimizing their GI symptoms. However, we know it can be difficult to eat enough calories and obtain sufficient nutrients, but patients with IBD can be at risk for malnourishment. And why is that? And how is that happens? So I think it's important to understand how does IBD affect digestion. For those living with IBD, the walls of the intestines can become, an easy way to explain, is red and swollen and inflamed. This inflammation can prevent the intestines from doing their job. Difference between Crohn's and ulcerative colitis, it's also important to understand. So Crohn's disease can occur from anywhere from our mouth along any of the whole GI tract, from mouth to anus. However, it usually affects the small intestine, more commonly the small intestine in our younger kids or in children. And that can affect properly digesting the foods and absorbing the nutrients. That puts our people with Crohn's disease, especially involving the small intestine, at risk of developing multiple or developing vitamin or mineral deficiencies. Because the food is not completely digested in the small intestine, it can travel through the large intestine and interfere with then the proper water absorption, and that can lead to the diarrhea or loose stools. In contrast to ulcerative colitis, that only affects the large intestine, it can prevent from properly absorbing the water. And water that does not get absorbed by the body stays in the large intestine, which makes the stool really watery and causes the diarrhea. Inflammation also causes ulcers and blood loss. Since ulcerative colitis does not impact the small intestine, most vitamin and minerals are properly absorbed. However, those with ulcerative colitis may still experience other issues or complications such as anemia or weight loss, which we will talk about in our next few slides. So what are the common IBD symptoms, as we know? So diarrhea. Diarrhea is the loose stools, a drops body of water, nutrients, and electrolytes. Of course, the numerous and frequency of bowel movements can cause a person to shy away from eating. It makes them fearful of eating at times. Nausea and abdominal pain can also lead to decreased appetite. Inflammation in and surgical removal of certain parts of the small intestine, which can happen for the Crohn's disease patient, can interfere with nutrient absorption. Generally, ulcerative colitis patients have fewer nutrient deficiencies, as we mentioned earlier. However, weight loss and anemia can be a prominent symptom or sign due to diarrhea and blood loss. So patients with ileostomy may also experience nutrient losses and dehydration if daily output exceeds a lot. So example is 1 liter for an adult. For children, it can be according to their weight. So how do we understand the healthy eating principles? So first is having to see a dietitian who has an expertise in IBD, encouraging your child to eat well, a well-balanced diet, as close as you can. Work with your child's medical team to screen for vitamin and mineral deficiencies. make sure they drink plenty of fluids, especially in the summer, especially during sports seasons. Keep a food journal with and for your child, and slowly introduce new foods just to make sure they are tolerating it. It's also important to, as we mentioned, that IBD patients can have vitamin deficiency. So what are the vitamins we worry about, and can also evaluate and make sure that they are not having these specific deficiencies. So B12 can happen if there is inflammation or removal of the small intestine, the region called ileum. Also, if the patient is on a specific diet, like a vegetarian or vegan, folate deficiency can happen if you are also taking certain medications, examples being sulfasalazine or methotrexate. Also to think about if there is inflammation in another part of the small intestine, which is called the duodenum. There are the fat malabsorption can happen. Specifically, the vitamins we think about when we are worried about fat malabsorption is vitamin A, D, E, and K, and that can happen with small intestine inflammation or removal and part of an area of the small intestine. Magnesium can happen if there is inflammation or removal of certain parts of the, again, small intestine, jejunum or ileum, or if there is a fistula, or that can be due to chronic diarrhea. Zinc is also an important mineral that we also have to keep in mind, and it can cause, you can have zinc deficiencies if there is inflammation or removal of the small intestine. Also can be seen with long use of prednisone or with chronic diarrhea. Calcium, which you all know is so important for the bones and growing bones, and a lot of times with IBD symptoms, patients may avoid dairy products or may have problems with tolerating dairy. So we need to keep that in mind. How do we replenish calcium? Other things to keep in mind is use of prednisone can affect calcium absorption, and of course, again, inflammation of the small intestine. Potassium is another one to keep in mind if somebody has chronic diarrhea or vomiting, and again, prednisone use. Vitamin D, which is again a very important vitamin for bone growth and bone health, and prednisone use can affect and put you at risk for deficiency of vitamin D. So working together to identify factors for nutrient loss and recommend replacement, optimize nutrition can improve healing, particularly after a surgery. And of course, it will help catch up growth after your initial diagnosis of a child. Make healthy nutritional changes to complement the medical therapies. So it's very important to work really closely with your gastroenterologist and dietitian. So this question comes up all the time. What should my child eat? I think we have to think about a balanced diet overall, is making sure there is enough fruits and vegetables, so there is fiber in the diet, which can provide essential minerals like vitamin C, potassium, and folate. Grains are an important source of fiber along with vitamin Bs, folate, and iron, and also can provide needed energy for growing bodies. Proteins can come from meat and also non-meat sources like soy, nuts, seeds, and beans. They're important sources of B vitamins, zinc, and iron. The other thing to keep in mind is protein is important for healing and repairing body tissues. If your child is low in iron, they may feel tired and have difficulty concentrating with schoolwork. Dairy is, again, as we talked about, is someone with a new diagnosis or have lactose intolerance can have problems with tolerating dairy, but we know dairy has an excellent source of protein, calcium, and vitamin D, which helps make bones stronger. So healthy fats, where do they come from? Is fish, plant-based foods like avocado, fish oils, and nuts, and you're introducing that in the diet as tolerated. These foods absorb fat-soluble minerals, and help the body meet their caloric needs. Also, we want to mention is the vegan diets that contain calcium and vitamin D rich foods such as leafy greens, soybeans, and lentils, and also fortified foods, but should be reviewed and closely with the dietitian. We do mention to avoid a lot of salty snacks and candies because that may help overall with tolerating the diet and less causing of diarrhea. What about during a flare? This is also an excellent question that we worry about and talk about. when a child is experiencing their IBD symptoms, when they're in a disease flare, what tips do we need to help through that process? So making sure they eat smaller meals, that may help reduce the cramping, reduce the amount of greasy and fried foods, because that may take a longer time to digest and may cause a little more belly symptoms. Avoid foods that may have had their symptoms worse in the past, so keeping those in mind, and focus on foods that you know they can tolerate. So at times we also say limit the amount of fibrous foods during a flare, but they can go back to eating more foods with roughage when they are doing well. Limit milk or milk products if they are lactose intolerant, and other sugar sweetened beverages that can worsen the diarrhea. Avoid caffeine in soda, tea, and other caffeinated beverages. So that keep that in mind when they are drinking through the day, because caffeine can also make you more dehydrated. Ask the team about which vitamin and mineral supplements that need to be taken if they are not taking anything regularly. And then, of course, encourage to drink a lot more water as they can to keep themselves hydrated, because if the flare is causing diarrhea too. If appetite decreases during the flare, it's important to reach out to the healthcare team about supplements that to help meet their nutritional needs. So again, is prepare in advance while eating out and holiday and special events. A lot of social activities involves eating, so as we know. So here are some of the helpful hints and recommendation. Knowing that you have to go out to dinner or to social events involving food can be a source of worry for some people with IBD that can cause more anxiety and stress. There is no IBD safe menu, but there are techniques and strategies to use to make dining a more positive experience. So some of the tips are: be prepared. Don't go out feeling too hungry. You may not make the best food choices, as you will be driven by hunger and desire to eat like a full meal and really fast. Call ahead of time if you have specific questions and review the menu ahead of time. Sometimes, most of the menus are available online now. This way you can identify the potential food problem and avoid feeling hurried by the server when reviewing options. While dining out, don't be afraid to make special requests. Many restaurants will alter how a dish is prepared. Eat smaller portions, perhaps an appetizer or half of a size of a portion. When in doubt, keep it simple. Go for boiled, grilled, broiled, or steamed or poached portions. Limit the sauces and spices, because that sometimes can aggravate symptoms. So it's very important to teach your child about food choices. When children eat healthy, they are more likely to follow good habits as an adult. Improve your child with meal planning and preparation. Involve them when choosing the food they would like to eat. Bring them the grocery shopping list and involve them with that part. Help keep them a food journal and let them read the menu. Are there any specific diets that has been looked at in inflammatory bowel disease? So how do I know if my child is getting these nutrients they need? So weight and height are the most important indicators for growth and development. We know that patients may have stopped growing even before their diagnosis of IBD is made. So there are enteral nutrition, which is a form of liquid nutrition that can be taken by mouth or delivered directly to your stomach or small intestine through a feeding tube, like a nasogastric tube, the tube that goes from the nose and sits in the stomach. The other way it can be, nutrition can be delivered, necessary nutrient calories directly into your bloodstream through a intravenous tube called a catheter that is inserted into a large vein, and the nutrients can be delivered safely through that route. So many people with IBD reported benefit from a particular diet. However, there are some things you should consider before adopting a specific diet. Most diets have not been scientifically proven to prevent control of IBD. There is a lot of debate in the medical community regarding the benefits of these diets. Many options exist, but few are well controlled and published studies exist. Diet can be very complicated and difficult to follow, specifically in a growing child. Some diets may be risky to your health and your child's health, increase the risk of malnutrition because they involve avoiding certain food groups that provide valuable nutrition, and then restricts, which may lead to further poor growth, poor healing, and leading to more nutrition deficiencies. A diet should not replace your medical treatment. So speak with your team, speak with your physician, speak with your healthcare provider and dietitian first before starting a particular diet. The best diet is the one that meets your child's nutritional needs, which is while helping them better manage their IBD symptoms. So important is to create a diet that works right for them. I'm going to touch base on a few important diets to just give a brief overview. First is the exclusive enteral nutrition. The other term is used called EEN. Diet therapy, it has been looked for mild to moderate Crohn's disease, in which 80 to 100% of calories come from the formula. It's used to induce remission and can be continued as a maintenance therapy if desired. So basically is you take formula by mouth or by feeding tube. It can be typically over 6 to 8 weeks. Some patients can do it over 12 weeks. It is known to improve growth and improve disease indicators with very minimal side effects. Remission rates have been looked at, and it's equal to remission rates achieved with steroids with, as I said, minimal side effects, and not the side effects what we see on steroids. The other is the specific carbohydrate diet called SCD. So diet therapy for IBD, which has been both looked for Crohn's disease and ulcerative colitis patients. So basically this diet, you eliminate grains and refined processed foods. The list gets divided into illegal and legal food groups. Some of the examples of meals and snacks that are allowed in this diet is like fruits, but not all fruits. So some of the examples like bananas and berries, vegetables, it's going to be mostly your non-starchy vegetables. So potatoes, for example, are not allowed in this diet. Nuts are allowed, eggs, preferably organic and free range. Dairy is allowed, but very specific. So hard cheese is allowed, and then yogurt that is fermented over 24 hours. So that is what we call SCD yogurt. The recipes are available easily. And beans and legumes, which provides, as we mentioned, good source of vitamins, minerals, and proteins, but they have to be soaked overnight. The sweetener that you can use in this diet is honey, and then meat and chicken, poultry is all allowed. The other newer diet, which has been seen to work well also is called Crohn's disease exclusion diet, or called CDED. It's a diet specifically for patients with Crohn's disease, and it's a combination of whole food diet with partial enteral nutrition. So you are still using formula, but it's partial, so not all like an exclusive enteral nutrition. In this diet, it removes saturated fat, animal fat, red meats, dairy products, wheat, yeast, gluten, so that it's divided into these 3 phases, and a lot of food and then food additives are removed. So you go from the strictest to stricter to the less strict diet in a maintenance phase. It kind of takes around 12 weeks to get into a maintenance phase. It has shown to be effective as an exclusive enteral nutrition for induction of remission and reinduction if somebody has another flare, and shown to be better tolerated than exclusive enteral nutrition in children with mild to moderate Crohn's disease, because it provides them with whole foods along with formula as an option. So what does the research say about all these different diets that we touch base on? So of course, again, the studies are limited. And on the impact of diet on IBD, most studies that have been conducted have been small, meaning they only looked at smaller number of patients, and this does limit the types of conclusions can be made at the end of each study. That's because there are many variables that can be involved when you're looking at an effect of diet in a patient. For instance, Crohn's disease versus colitis, where is the disease located, small versus large bowel, what was the disease activity at the time, was it mild disease, moderate disease, or severe disease? And then further, it's important to, that a diet is doing more than just helping with GI symptoms, right? So the diet may be targeting an underlying cause of the disease, such as intestinal immune system or changing the microbiome. So the diet impact has to be the same at the same level as a medication. So what are the diet studies supported by Crohn's and Colitis Foundation? So DINE-CD research study. This has been the first ever national study of diet intervention to manage Crohn's disease symptoms. The diet to induce remission in Crohn's disease, DINE-CD. So it was a randomized clinical trial that compared the effectiveness of specific carbohydrate diet, or SCD, which we talked about earlier, to a Mediterranean style diet. as a method to improve Crohn's symptoms and patient quality of life. This was a very unique research project because DINE CD study in many ways was proposed by patients. The two diets compared in the study, as we said, SCD and Mediterranean diets, are both thought to have a potential to improve IBD symptoms based on a previous research. The study was done in adults. The SCD is one of the many diets that patients ask us about and been seeking to use diet to help their symptoms. A Mediterranean diet is known for its overall health benefits and has been linked to lower all-cause mortality and risk of developing other conditions in adults like heart disease and cancer in general population. The FARM study is another wonderful study. It's a 3-year study comparing the effects of different diets on the gut bacteria and bacterial products. In the FARM study, healthy volunteers will follow a defined Western diet or a vegan diet or a formula diet for 2 weeks. And the researchers will look at how these 3 diets affect the microbiome of each of these patients. And the findings will be important first step towards the understanding of formula diet, which we talked about. The exclusive enteral nutrition works to induce remission in patients with Crohn's disease. The hope is that this work and discovery will help provide a launching pad for developing new interventions aimed at manipulating the microbiome targets with the goal of treating and even preventing IBD without suppressing the immune system. So what our take-home messages are that IBD is treated through a variety of treatment approaches, good nutrition, and it does not replace conventional medical or surgical therapies for IBD. So complementary approaches can help with symptom relief, but talk to your child's doctor before starting any alternative therapies. There is a lot of resources available at the Crohn's and Colitis Foundation page. There are also pediatric focused publications, information that you can provide to the school. There are activity books for the child to help them understand about their disease. A lot of resources regarding diet and nutrition. Important is Camp Oasis, which is a wonderful camp that happens yearly in a great place for safe and supportive camp for ages 7 to 18. The page is just like My IBD, is a great resource for kids and teens, and then support groups Empower 2, which connects with other parents and children with IBD. The IBD Health Center is another great resource. It can provide more information, guidance. There are support groups and education programs that are happening. Free brochures. It's available in 170 different languages for your medical team. The phone number is 1-888-MY-GUT-PAIN, and the email address is listed here as info@crohnscolitisfoundation.org. They are available from 9 to 5 Eastern Time. And of course, there's wonderful live chat available too. Thank you very much for joining me today. I hope this was helpful.